Today, going to go through another imaging. We're going to talk about like X-ray and what to discuss with a patient, after these accidents. And in car accident work, you're going to get a lot of X-ray, whether you take it or whether it comes in from the hospital. And with an X-ray, there's nothing you're going to see on the film that wasn't there prior to the accident, unless it's a fracture, dislocation, a bunch of soft tissue swelling, things to that effect. So you always have to be aware of that when you're having a discussion with the patient about what you see, because many times when they're coming in with the intake, they may report to you that they were having no neck pain, no symptoms in like the cervical spine. We're using the neck as an example because that's what I've got here. But just making sure that you keep a lot of that in context with them, because anything that you see on the film is likely been long-standing and was not giving them an issue, and is probably not even causing them the discomfort that they're currently having after the accident. So you always have to take everything with give them everything with a grain of salt, and really even depending on on how the patient's feeling at that point in care, because maybe the X-rays didn't come back for quite a while. There's some things that may not even be worth having a discussion with the patient. Let's say this person in particular that we've seen recently, zero neck complaints, neck pain prior to the accident, had never been to anyone for any sort of neck issues, and we've got neck tightness, pain, things like that post accident. Get the X-ray done, and the X-ray talks about no fracture, no dislocation. The main structures that you look for, the integrity, in radiology, are all intact. Everything's fine there, and that as in radiology, they have to comment on everything that they see during the report. So you might see something towards the bottom, like C5, C6, C6, C7. We're having end plate spurring and disc space narrowing. Fine. These things don't really make a difference in how you're going to care for the patient, and in the end, those things were present in the patient's neck before the accident, and they weren't having neck pain. So when you are having that discussion with the patient, saying, we've got the reports showing these moderate disc space narrowing, C5, C6, C6, C7, because you do want to kind of go over what the report says, because they're going to get a copy anyway. You just have to make sure you have that that level of conversation with them, and make sure they understand, hey, you are this particular patient is 45 years old. So pretty much anyone who's 45 is going to have some level of disc space narrowing in their cervical spine, regardless of previous accidents or injuries. So you just want to make, hello, everyone. Sorry, I didn't notice people coming in. I was just busy talking about what I was looking at. But thanks for joining if you're into X-rays and talking to patients. But so in the end, you just want to make sure that you don't leave them feeling worried or scared about what's on the X-ray, especially if they're already improving, already feeling better, we're not having problems before. Just make them aware, these things are seen on the film. They weren't giving you problems before the accident. They're not probably what's contributing to any symptoms that you're having after the accident. You're already improving, and just as a note, as somebody who's 45, there's already been some fairly normal small changes to the spine and discs of your neck, and just always make sure that when you're having that discussion with the patient, you don't leave them being scared or fearful of what they're seeing. We'll have some whole other discussion another time about how people out there in healthcare will use X-ray reports as a way to create fear in a person to motivate them to have care. So just be careful when you're covering these things. Make sure the patient's comfortable with what you're doing. In the end, these things that we're seeing not going to matter much in outcome and care plan, and they're going to be okay either way. Have a good time. See you guys later.